Good evening, everyone. My name is Nelson Leibel, and today I'm going to be talking about the parvovirus with Dr. Burnham, who's been working on this for 25 years in West Palm Beach. So you guys ever need a veterinarian? She's here to help you. So, today we're going to be talking about the parvovirus, which is a very deadly virus to many young dogs. So Dr. Burnham, what do you know about the parvovirus?
Well, everybody, I believe most people know parvovirus because they hear parvo. Parvovirus is actually a pretty new disease. It first appeared in the late 1970s, and within 2 years it became worldwide. We suspect that it was a mutation, believe it or not, from the feline panleukopenia. It's 98% similar to the feline panleukopenia. We know that it affects canines, it affects wolves, foxes, and other canids. We also have seen that in Vietnam, there has been some canine parvovirus 2, which is the actual virus name, that has affected felines or felids. So it's interesting that there is now a cross canine and feline parvo out there.
Very interesting. I have another question for you. So, we're talking about the viral strains. Is there like any kind of different than just parvovirus 2, or is there like an A or B or C kind of difference?
Canine parvovirus 2 was the original strain. The strains that we see now, the most common one is canine parvovirus 2B, and there's a new one, canine parvovirus 2C. The vaccines that we have available are protective for all of them. In the late 1970s, there was no vaccine available.
So what were you doing back in the 70s? Like, what would you do?
Well, I was still in vet school. I wasn't yet even in vet school when this happened, but I do recall coming out of vet school and having to deal with massive bloody diarrhea and having all these puppies on IV fluids. And I would say at that time, it was 50-50, the chances of survival. Now we have a better chance if we get the animals in quickly and start them on IV fluids. Broad-spectrum antibiotics, antiemetics to stop the vomiting, and we're seeing like 21% survival rates. There are some unconventional treatments that I actually find that seems to work. Tamiflu is a human antiviral. If we get them early, I have found that these dogs respond a lot quicker. So that's just my 2 cents in there.
So here's a question for you. I hear you talking about the mortality rate only 21%. Is it really the reason there's a 21% mortality rate is because people bring them in too late and you really can't reverse the signs and all?
Well, the main reason these puppies die from parvo is from dehydration. So they're young, they're very young, and a lot of times they have parasites as well. So they have intestinal parasites, they have a poor immune system, and they've probably been having vomiting and diarrhea for a few days. Once you have that bloody diarrhea, people bring them in pretty quickly. But that's been going on for a little bit, and by the time that we see them, if they've started to become very dehydrated, lose protein, if their red cell count is going down, then they become systemically ill, they get septic, the chances then become poor for reversal. But I have seen some that come, they look like they're dying, they're ready to die, gotten them on fluids, gotten them on the antibiotics, antiemetics, given the Tamiflu, and believe it or not, within a couple of days they're back on their feet.
That's great. What does Tamiflu do for it? Because I know it's a human medication that reduces the time by 1 day, I think, or something like that.
If you get them early, it seems to reduce the replication of the virus.
That's very interesting. So in humans, I know it cuts back the symptoms for a day. Is it kind of the same deal?
You know, the ones that I've seen, I really find that it really reduces. You know, usually I would keep them in the hospital for about a week. With the Tamiflu, within 24 to 48 hours, I see them better.
Yeah, very interesting. So I heard you talking about that cats can actually get it in Vietnam. So would the host be both cats and dogs, but I guess in certain region it
Exactly.
happens?
Yep. So that's correct.
Okay. Symptom-wise, so I'm guessing for the cats it's a little bit different if they did get it. Again.
Yeah. I have never seen a case of feline parvovirus, the real canine parvovirus 2. I see panleukopenia, but that's a different virus. the symptoms that I see, and people a lot of times will miss it. They have a new puppy. The puppy is usually very hyper and active and playful. They may miss that the puppy at this point is not as playful as it used to be, so it's already in the system. It's already starting to show some symptoms. Then they may start becoming not wanting to eat as much, and then they can develop a fever. They can start having diarrhea and vomiting. And usually it's a very, very bad, severe diarrhea, very bloody diarrhea.
So they can also have anemia as well on top of that,
Yes.
so they can decrease a lot.
Yeah. A lot of times they can have other viruses, so other viruses can take advantage of a depressed immune system.
So is there any kind of dogs that are more susceptible to this virus, or is it kind of all around the same?
The large breed dogs are tan and our tan and black dogs, our Dobermans, our Rottweilers, our Shepherds, and even Pit Bulls seem to have much higher chance of developing parvo. And I don't know if it's the color variation or it's just that these are big dogs and they reach maturity later, so their immune system also reaches maturity later.
So diagnosis-wise, what kind of things would you do to figure out if they have parvo or if they have something else?
So the first thing I do is I always check a stool sample. Stool sample, I'm going to check for intestinal parasites, but with a young puppy that's having the symptoms I mentioned, I would also do a parvo test, and that's an ELISA test, and that will tell me if the puppy's positive for parvo.
Okay. If that doesn't work and they do have parvo and you missed it somehow, what would that mean?
If there's low numbers of viruses, we can do what's called a PCR, and that test amplifies the DNA, so it's easier to find the virus.
Okay. So treatment-wise, what would you do?
Treatment-wise, I would get the puppy on IV fluids. I would discuss about using Tamiflu, even though it's not an approved treatment. I would still recommend that. I would get them on IV fluids. I would do antiemetic. Cerenia is one of the injectable antiemetics that I see works very well, and I would get them on a broad-spectrum antibiotic. We also have Convenia, which is a broad-spectrum antibiotic that lasts 2 weeks, and that seems to work really well. University of Kansas had done some research, and they found that dogs that were treated, not in the hospital, but that were treated on an outpatient basis, which means they were given fluids at home, subcutaneous, not IV, but given fluids subcutaneously. They were given Cerenia, and they were given Convenia, had an 85% chance of recovery, which is really high. And also, we found that the dogs that were treated in the hospital had about a 90%, which is the better way, obviously. But the cost is so expensive. Treating them in the hospital is anywhere from $1,500 to $3,000, whereas treating them as an outpatient is $200 to $300. A big difference.
Right. A question though. So for that 85% or 90%, does that mean they're all the way to their really bad level, or are they just kind of starting off?
Usually the ones that do that well are the ones that come in and we get them right away started. The ones that don't do as well are the ones that come in later in the course of the disease.
So if they're, let's say, at the worst part of the disease and they try to do this area, could it work?
Yes. I have seen the ones that have been severely dehydrated, and I've turned them around.
So it's possible, but I'm guessing a very much lower chance.
Yes.
Okay. So how about vaccines available? I know there's a vaccine available for, you said the most common was B, correct? Is there one available for A and C, or is it just kind of all based around the same?
It's the same. The vaccine is for B, but it appears to be good for all the different strains, so cross-protective.
And so here's another question. I actually don't know this answer, so I just wanted to hear your opinion. Is it a core vaccine or non-core? I'm going to say it's a core one because of the reason it's very deadly and contagious.
Yes, it is a core vaccine. We start puppies at 6 weeks of age. We give it every 3 to 4 weeks until they're 16 weeks of age. Some people recommend 20 weeks for our black and tan dogs, our giant or large breed dogs, to give them another booster of parvo at 20 weeks. That's kind of on and off type thing.
Okay. So another question I have for you. If, let's say, an animal gets parvo, do you still give them the vaccine, or do you wait till they get better then give them the vaccine?
Right. Most of no, when an animal's sick, you don't give them the vaccine. Actually, some people come in for that. No, the treatment is still supportive treatment, which is the fluids, antibiotics, antiemetics, and so forth.
What would happen if you did get the vaccine? Like someone, I guess, doesn't know, and they're like, okay, we'll just give them the vaccine. What would happen to the animal?
Well, they already have parvo. It's not going to help them, you know. So.
That makes sense. So here's my final question for you. What is the worst parvo case you've ever had, and have they been able to turn around?
It was a non-client. The puppy had not been had any vaccines, had not been dewormed. Basically, had not had any veterinary care. The dog appeared to look like a little skeleton. It was severely dehydrated. It just was not moving. Obviously, you know, they hadn't taken very good care of the dog, and you know, they came to me, and they couldn't afford to have the dog on fluids. They really couldn't do anything much, so I gave them sub-Q fluids, sent them home with fluids. I gave them the injection of the antiemetic and the Tamiflu, and I did not expect, you know, to call and find out a few days later the dog was doing great.
That's very interesting. Did he gain his weight back? Or
Oh yes, he did. He did. Now remember, they still shed virus, so it's important to make sure that you keep them isolated from this dog. There's also, we're talking about canine parvovirus enteritis, but there is another one that's very rare. It is the cardiac one. I have not seen one in all my years, and it's been actually going on 29 years that I graduated from vet school. So I've never seen that, but I've heard of it. Most of the time these are puppies that are exposed in utero when mom is pregnant, and a lot of times they have, you know, they're basically have cardiac disease, and if they survive, most of them don't survive. They have other abnormalities, but most of the time they have heart disease. And I have heard of other dogs that have survived the canine parvo enteritis, and they go on to develop the cardiac one and don't survive from that one.
But here's my question. So the cardiac one, is it because the female has the virus already inside of her, and then when she becomes pregnant, it travels through the placenta into the puppy as well? Is that how it works?
That's how it works.
And then they have a cardiac abnormality, and then they get it, and then it's very interesting.
So it's very important that the puppies get vaccinated appropriately, and then the dogs, adult dogs, after they've had their initial vaccinations, they also get the parvo at least every 3 years after that. So,
Thank you so much, Dr. Bruno.
you're welcome.
And if you can say thank you to the audience.
Thank you.
And have a wonderful day, guys. Bye.